seconds about how that felt. I'm not waiting 30 seconds because I keep running out of iPad storage. Okay, so we're going to get back into your groups of 3 and figure out amongst yourselves how and why things were different and how and why things were done similarly, and why did the results happen that could happen. So in that video where the refusal was, just kind of discuss that amongst yourselves. Okay. Use your PAC card, I'm going right through this, to consider possible relationships between person-focused and task-focused care interactions. What could possibly be causing the differences? And how could you use this care cycle to help you begin to develop your routine of care so that you remain person-focused during all task assignment attempts?
Maybe I needed to greet her and make better eye contact and compliment her and get more of her attention. Then she wouldn't refuse.
So in teams of 3, use your PAC care cards to practice your preparation section, and about TIPA on the video you watched. For each item, write down what you need to do for each item. And that would take 2 minutes, but once again, I'm not doing that right now. So step 1 is prepare. You need to know your agenda. So you identify the task and what is liked or disliked. What did she like or dislike about your interaction? What did she want or not want? And what's needed and what's dangerous. So that would be, you want to prepare yourself with each patient. You know, for instance, one patient might not care if you come right up and, you know, tap them on the shoulder, and another person might try to hit you depending on how they're feeling. Prepare yourself, have your skills check, match your resident inabilities and fill in the gaps. So whatever your patient can do, the person living with dementia, you learn to figure that part out, and then you change, you don't make them change. Prepare your materials, have everything ready, check your space and your environment, make sure you're going to have the proper amount of room and the quietness and proper lighting. Check the time availability and timing during the day. Perhaps someone may not want to brush their teeth first thing in the morning, but they might do it after breakfast. So now I want you to use your person-centered focused cards to try your prepare step, in which each person gets to practice it once. And this would be 4 minutes. Can't do that. Now move into step 2, write and plan, and then try it. But now you'll start with step 1, prepare, and add in step 2. And step 2 is seeking permission. Greet before you treat, and that's why you try to get their attention and focus and do all of that. And you're going to do the positive physical approach and the positive connection and reflect. And we're going to repeat the process for step 3, and that's notice the response and you get permission for your mission. Use the multi-model sequence communication and seek understanding. You establish connections. Respond with empathy, and determine the willingness to try the proposed task. If it's no, if permission is not granted, thank them for the interaction, and then go to your mentor and try to find out what it is that you can do together that can make this better. You're going to repeat the process. Where permission has been granted, it's called learn to dance with your partner. You proceed to the task, you stay connected, you respond, and all the efforts are done, and you appreciate them all, and the task has been completed with the person. Step 5, you're going to proceed with each step in the task you're doing with it until we are through. So you know the completion or the transition of the task, you pause, you offer thanks, thank them for their time, thank them for their effort, for doing as much as they can. You offer 2 options for transition. Would you like to go to activities, or would you like to go get a cup of coffee? Follow through with the selection, and when it's complete, then you disconnect, tell them goodbye, and then you'll reconnect again if you need to. And you do that again when permission is not granted. If permission is not granted, you go and explore other options with your coach. Okay, to wrap it up, let's watch the video depicting person-centered care one last time. As you watch, follow along with what your team wrote for each step. So we'll look at your video, and we'll watch how each person, and you watch each of your own person-centered video. So you're each watching your own video. Then we're going to sit back down and we're going to talk. So what did you see and hear that was similar between the videos? What different between the videos? That was similar maybe in your interactions when you guys were interacting as the caregiver?
Oh, we both greeted each other and kept eye contact.
Okay, and what were with your interactions when you were the person living with dementia? Is there anything similar in the interactions between the two of you when we'll?
No. No.
Okay. Why are there, how can you stay focused on a person focused in the task? So, with all the tasks you're responsible for in the support and care of a patient living with dementia, which ones are the least and most challenging for you to stay person focused? You've been an aide, so of all the tasks you have to complete as an aide, which one would be the easiest, you think, to complete this way, and which one would be the most difficult?
Most difficult would be someone that doesn't want to make eye contact and doesn't want to respond to you at all.
But which task would be hardest, do you think, like with teeth brushing, getting dressed, combing hair, getting a shower, toileting? What task do you think would be the hardest? And which would be like the most challenging, and which one do you think would be like the least challenging?
Probably the teeth brushing would be the most challenged, because if they're not cooperative and they don't want to make eye contact or focus, then they probably wouldn't want to open their mouth, so it'd be difficult to get that toothbrushing in.
Okay, so which one do you think would be the least challenging? Which one do you think would be the easiest to complete in this, using a person living with dementia focused?
Maybe getting dressed.
Okay, so look over the entire PAC care cycle when you're going to begin focusing. As you begin focusing, you'll move forward in the CNA curriculum for CNAs in Indiana. We want you to please practice this, and we're excited that it's going to allow you to see the patients as not patients, but people just living with a disease. Their disease just happens to be dementia. You have people living with cancer, you have people living with high blood pressure. These are just people living with dementia. And so we hope you will use these and refer to your coaches and your trainers if you have any difficulty. And then we can maybe have meetings every couple of weeks during your clinicals and you can tell us how things are going. Okay? Thank you.